Good morning and welcome to all school students, teachers, and parents from all around Malaysia, not forgetting to all UMS students and all UMS staffs present in this session today. Thank you for joining today's session of STEM Speaker Series, Nutrition for COVID-19. My name is Elmindreda Chung Vun Kee, a third-year mechanical engineering student from the Faculty of Engineering, and will be your moderator for today's session. For those who are joining us for the first time, this STEM Speaker Series is a co-joint effort with the Faculty of Food Science and Nutrition, University Malaysia Sabah, aiming to deliver a unique and interesting STEM topics designed by subject matter experts to increase the interest of school students, teachers, and community alike in venturing the fields of STEM. For any questions from the audience today, please feel free to drop your question on the chat box at the right side of this YouTube live session. For your information, e-certificates will be given to school students and UMS students by filling in the Google form through a shared link by the end of this session. Please stay tuned with us. With us today is a distinguished academician from Faculty of Food Science and Nutrition, Dr. Khor Ban Hock. Dr. Khor Ban Hock is the Senior Lecturer of the Nutrition Program for the Faculty of Food Science and Nutrition, University Malaysia Sabah. He obtained his bachelor's degree in dietetics and PhD from University Kebangsaan Malaysia. He worked previously as a clinical dietitian at 2 different hospitals under Ministry of Health Malaysia for 4 years. Khor's research interests include fatty acid metabolism and nutrition in patients with kidney diseases. Khor is the committee member of several guidelines, including the Malaysian Dietary Guideline 2020, Malaysian Dietary Guideline for Children and Adolescents, Medical Nutrition Therapy Guideline for Critically Ill Adults, and Medical Nutrition Therapy Guideline for Chronic Disease. So without further ado, please welcome Dr. Khor with his topic, Nutrition and COVID-19. Doctor, please be invited.
Hello. Hello, good evening, everyone, all students. Welcome to today's topic on nutrition and COVID-19. I hope you are able to see the slide now. Okay, just a moment. Yeah, I should be showing now. Okay, so I got this invitation to speak on this topic a few months back, back in April. And then they told me that your talk will be scheduled in August. So at that point of time in my mind, okay, there's still another 4 months and probably this topic will no longer be relevant by then. But very unfortunately, that by yesterday we have the highest confirmed new cases reported in Malaysia. So I think so the topics today remains relevant as we are still facing the pandemic of COVID-19, and this virus is very stubborn, just doesn't go away. So I hope that today's topic will be able to give some information about the nutrition during the COVID-19 pandemic. So a bit of background of where I come from. So I'm from the Faculty of Food Science and Nutrition, or Faculty Sains Kesihatan, Sains Makanan dan Pemakanan. So we have offered 4 undergraduate programs, which include Food Science and Nutrition, Food Technology and Bioprocessing, Food Service, and Nutrition. So I myself is from the Nutrition program. So as per our topic today, nutrition and COVID-19. So what is nutrition? So nutrition is the science of food and its relationship to health. So in the field of nutrition, we seek to understand and investigate what are the potential health implications of particular food, because we know that foods foods are very important to us in terms of the growth, development, and maintenance of our body. And what we want to look into the foods are mainly known as nutrients. So it's the compounds in foods that are essential to life and health. So it has many functions, including providing energy for us so that we can do our daily activities, building blocks for repair and growth, and regulate chemical processes. And by easy definition, we can classify the nutrients in the food to either macronutrients and micronutrients. So macronutrients, by its name, macro means in larger quantity. So basically, these are the three main nutrients that provide us with energy or calories. We require to consume these macronutrients in larger amount. And the example of macronutrients are carbohydrate, protein, and fat. So the carbohydrate sources come from our cereals, like our rice, noodles, and also the starchy vegetables such as potatoes, tubers. These are all the sources of carbohydrate as well. Fruits also contain fructose, which is a type of a carbohydrate, milk products, as well as sugars and legumes, beans. So these are all examples of foods high in carbohydrates. And we have also protein, which are including chicken, meat, fish, egg, milk. And lastly, we have fat, come from the oil and all the spread. So not all foods contain only one type of macronutrients. Like for example, milk. Milk contain carbohydrate, contain protein, and contain fat as well. Beans and legumes, they also contain carbohydrate, protein, and fat. So carbohydrate is the main source of energy for us because when we digest carbohydrate, it becomes glucose. So this sugar is required to generate energy for our body to do our daily activities. Fat is also one of the important source of energy, but be careful, excessive fat leads to issue with obesity or overweight. Protein can provide energy to our body, but more importantly, protein is being used as the building block for our body, as well as a lot of chemical substances that are produced, such as antibody. So after we discuss about macronutrients, then now we will come to micronutrients. This includes the vitamins, minerals, and trace elements. So these micronutrients, even though is required in a very small amount, but if someone is having deficiencies in micronutrient, it can lead to very devastating consequences or a lot of health problems. So these are the nutrients that are important to health development and well-being. And most micronutrients can be found in different foods items, like the vitamins you can find in fruits and vegetables, and some of the whole grain products, while some of the mineral like calcium can be found in dairy products like milk. So we have food items that contain different macronutrients and as well as different micronutrients. So after we have a brief introduction, what are nutrients, what are macronutrients, and what are micronutrients? So now we want to focus on another topic of our talk today, which is COVID-19, which is coronavirus disease 19. So this is an infectious disease, meaning it can spread from one person to another person. So remember, the virus doesn't travel. Human that carry the virus traveling around are the ones that spread the virus. So this disease is caused by a virus that named as severe acute respiratory syndrome coronavirus 2 or SARS-CoV. And the symptoms can be very different from one person to another person. Some person will have no symptoms at all, while another person may experience severe symptoms. And these are the common symptoms like a cough, fever, a fatigue, headache, muscle ache, pain, loss of taste or smell, and skin rash. And some individuals who get COVID-19 may actually get serious symptoms such as progressive respiratory failure, which is a difficulty to breathe, up to pneumonia, multi-organ failure, and death. And not the previous study have suggested that these individuals, they are at risk of getting the severe complications of COVID-19. Like for example, being overweight and obese, those with diabetes, either it's a type 1 diabetes or type 2 diabetes, those with hypertension, coronary artery disease, which means heart disease, chronic kidney disease, cancer, or chronic lung disease, or as well as smoker. But with the new variants of COVID-19, even some individual does not have all these underlying diseases, they still at risk of getting a severe complication of COVID-19. And by being overweight and obese is one of the risk factor of causing someone to have severe complications of COVID-19. It's very unfortunate that based on a survey that was done in Malaysia, 1 out of 2 adults in Malaysia were overweight or obese. So meaning that 1 in 2 are having a BMI above 25, which is overweight, or body mass index above 30, which are obese. And these people generally are female of Indian ethnicity and those aged between 55 to 59 years old. So BMI evaluate whether someone's body weight is appropriate to their height. Whereas another measure that we can do is measuring the waist circumference. And those with high waist circumference, which is 90 centimeter in men and 80 centimeter in women, we consider them as having abdominal obesity, meaning that there are a lot of fat around the tummy area. And similarly, we also can see that most people are having this abdominal obesity are those females of Indian ethnicity as well as those aged between 60 to 64 years old. And being obese, overweight, or having abdominal obesity is not just affecting the appearance, because we can see that major diseases that are associated with this overweight or obesity, including having diabetes, high blood pressure, or heart disease. And as we explained just now, these are all the diseases that associated with or linked with higher risk of having severe complications of COVID-19. So knowing that COVID-19 can cause severe complications, so now we try to understand how it's being transmitted. So the transmission of COVID-19 mainly by the exposure of the respiratory fluids with carrying the virus, that when someone sneezes or cough or even talking, so there is I would say there will be a lot of respiratory droplets. And if someone who have inhaled the respiratory droplet from someone with that disease, then they could get infected. And some of the respiratory droplets, they are very tiny, so they can float in the air for quite some time. Whereas those bigger droplets may drop on the ground or any surface. So the deposition of this droplet at the mouth, nose, or eyes is where the virus get into our body. And as well as if our hands are dirty, if we have touched all these respiratory droplets, and then we touch our eyes, our nose, our mouth, and that's how we introduce the droplets to our body with the virus inside. So how can we prevent the transmission? Of course, first will be physical distancing. Don't get too close with anyone. So because we need to remember, no one, you can't assume, or we won't know if someone really have the virus or not, because some people will really have no symptoms. So maintaining physical distancing is very important. So we put on a well-fitting mask so that we do not inhale or we do not excrete a lot of respiratory droplet when we talk. So by having well-fitting masks, meaning that we don't expose our nose, because you know some people when they wear masks, they will just only wear until the mouth area without covering their nose. So it's very important to wear well-fitting masks. And nowadays, we even recommend for a two layer of mask. So one surgical mask and with one cloth mask. And make sure it's adequate ventilation and avoid indoor spaces that are crowded with people. Practice hand hygiene before touching your nose, your eyes, your mouth, so that you don't introduce the virus. And having a good environmental cleaning, because you wouldn't know someone who has sneeze or cough and their respiratory droplet will have dropped on the door handler, all kind of places that we commonly touch. So having a good environmental cleaning is very important. That's why whenever there's a positive cases being notified, generally there will be a decontamination at the area to clean the area. So going back to our topic today, nutrition and COVID-19. So the question is, can nutrition prevent the transmission of COVID-19? So the answer is no. There's no food that someone can eat and can say that, oh, I have eaten this food, so I won't get COVID-19. And there's no dietary supplements, either it's a vitamin supplement, mineral supplement, or fish oil, or cod liver oil, whichever supplements that can protect someone from getting COVID-19, other than maintaining good social distancing, proper hygiene practice, and wearing a well-fitting mask. So these are the important measures to prevent the transmission of COVID-19. But what we can do related to food is, first we look into the type of food service and the risk of getting COVID-19. For those that are low risk, the food service are generally drive-through, by delivery, or taking out. So this kind of food service pose lower risk of getting with the transmission of COVID-19. And those with more risk, including dining in, but at outdoor, because we mentioned about good ventilation is important. So those dining in at outdoor with a sitting space at least 6 feet apart, okay, they're more risk. And those with high risk, including those with outdoor dining, but the sitting space is less than 6 feet, or those at indoor dining with sitting space more than 6 feet. And those at the higher risk are indoor dining with sitting space less than 6 feet apart. So basically, it's not about whether the food that can prevent someone from getting COVID-19. It's about how should you, how is the habit of consuming a type of food service. Like nowadays, we generally don't recommend this kind of food service, whether it's a steamboat, or it's a buffet, or it's a dining in with a lot of people without social distancing, such as in the banquet. So because this kind of food service pose a very high risk for the transmission of COVID-19, and we generally don't recommend sharing of eating utensil, because you wouldn't know whether the person who share the utensil are really free of COVID-19. When it comes to food safety, after we bought the fruits and vegetable, or before we store it, it's very important that we need to wash with the clean water. When we handle food packaging, we wash our hand properly and before we eat, because we don't want to introduce the virus to our body. And we make sure that all food must be thoroughly cooked at least 70 degrees Celsius to kill the virus, and maintain safe distancing when we go shopping and while queuing to pay. So during the pandemic of COVID-19, we recommend reduce the frequency of going to the supermarket. Like I myself, I will practice planning ahead before I go to the supermarket. So when I reach there, I know exactly what food that I wanted to buy. So I don't go and push the trolley and spend hour walking from one alley to another one. I will quickly go and grab the foods that I want. And very important for foods like vegetables, some vegetable can last longer, but some vegetable will not last that long. So you have to really plan ahead. Like, okay, let's buy a combination of both the vegetable that doesn't last that long, that you can consume in 1 or 2 days after buying. And those vegetables that can last longer, you can buy more and store in the fridge. That will reduce the frequency of you needing to go to the supermarket to do the grocery shopping. Well, that is about some measures that how we can do as a means to reduce the transmission or reduce the risk of getting COVID-19. So now we will focus on the 4 important roles of nutrition during COVID-19 pandemic. So that will include about our immune system, nutrition during lockdown, nutrition during recovery, and nutrition and vaccination. So the first part, we will talk about nutrition and immunity. So we all have an immune system that can help us to fight against virus. So they are like the soldiers in our body. So when the virus invade, they come in, so they will play the very important role to fight with the virus. And nutrition is very important because with good nutrition, it can help to support our immune system to fight against bacteria, viruses, fungi, or parasites. And we need not only one type, but a wide range of nutrients are needed to support our immune system. So these are a few important nutrients: vitamins A, B6, B12, folate, vitamin C, D, E, and trace elements such as zinc, copper, selenium, irons are very important to support the immune system. Having said that, we shouldn't think that having more is always better. The truth is, if we are lack of certain nutrients, it will weaken our immune system. But taking more than what you need is not going to boost the immune system to function beyond what it can already do. So what I want to emphasize is we need to make sure we have adequate, and it's not necessarily means that because these nutrients are important to our immune system, therefore we want to eat a lot of that nutrients, because some nutrients can be harmful if we consume in excessive. So we talk about vitamin A. It's very important for the maturation and the function of our immune cell. So that's why if someone is lack of vitamin A, it will weaken the immune system. And where can we get vitamin A? So the dairy products like milk, yogurt, and egg, liver, oily fish, dark orange or green leafy vegetables like broccoli and carrot, orange fruits, and cereals that are fortified with vitamin A are good sources of vitamin A. And then we have our vitamin B family, vitamin B6, B12, and folate. So these are important vitamins that support the activity of immune cells that are important in antiviral defense. So we know we want to fight against this COVID-19. So these vitamin B are very important in the antiviral defense. And for B6, we can get it from meat, fish, poultry, eggs, soybeans, and tofu. For B12, B12 is exclusively found in only animal products. So we get from fish, meat, shellfish, or some cereals that are fortified with vitamin B12. As for the folate, we will get it from green leafy vegetables like broccoli, spinach, kale, or cabbage, legumes, as well as cereals that are fortified with folate. So vitamin C is not uncommon that because with the pandemic, everyone talk a lot about vitamin C because even vitamin C has been proposed to be very important to fight against flu. So people will think, okay, flu and COVID-19, the symptoms are quite similar. So it probably would be beneficial. Yes, vitamin C is important for the immune cell function and antibody production. And having lack of vitamin C, meaning not getting enough vitamin C, makes someone very high risk to a severe respiratory infections such as pneumonia. But exceeding the recommendation of vitamin C beyond the toxic level could be dangerous as well. So taking adequate vitamin C from our daily foods is more than possible because we can get it from a lot of fresh fruits and vegetables such as guava, mango, papaya, orange, cabbage, cauliflower, and ulam. So our fruits and vegetables are good sources of vitamin C. And then we have our vitamin D, which is important in multiple components of the immune system. And people who have low vitamin D level, they are at risk of having the viral respiratory tract infections. So of course, our body can synthesize the vitamin D with the sunlight exposure. And some of the dietary sources of vitamin D include oily fish like salmon, tuna, sardine, eggs, and fortified products. Then we have vitamin E that enhance the function of the immune cell and antibody productions. And vitamin E generally come from oils like the vegetable oils, our cooking oil, or the fat spread from vegetable oils. Some seeds and some nuts are all good sources of vitamin E. And zinc is also another component or trace element that has been highly become popular during this COVID-19 because we know that zinc has an important role, especially against RNA viruses. So where can we get zinc? Meat, poultry, fish, shellfish, nuts, seeds, legumes, and whole grain products are all the good sources of zinc. And copper is another trace element that have antimicrobial properties as well as support the immune cell activity. And the dietary sources of copper include shellfish, livers, and nuts. And selenium as well is one of the nutrients that when someone is not having enough selenium, it will affect the immune response. So where can we get selenium? Similarly, we can get in meat, fish, shellfish, eggs, and milk. And some nuts like Brazil nuts are very high, rich sources of selenium. Lastly, we have iron because having iron deficiency increases the risk of getting infection. But this is a very important remark. Having too much of iron overload can also be harmful to our body. So the dietary sources of iron can come from animal-based like meat, fish, and poultry, as well as dark leafy vegetables such as kangkong and spinach. So having consumption of iron with vitamin C can help our body to absorb the iron. So after we talk about so many nutrients, some people will ask, do I have to go to buy supplements of all the nutrients because we know that they're so important? At this moment, we do not have enough studies to prove that we need dietary supplements to either prevent or treat COVID-19. And mega doses of vitamins or mineral can induce toxics and adverse effects. But having said that, not some people who cannot meet their vitamins or mineral requirements, they probably need the vitamins if they are not able to get it from the food. But for people, or generally most of us who can eat adequately, there's no need for dietary supplements. So we just follow our Malaysian food pyramids. This is the new food pyramid that is published last year. So at the bottom of the food pyramids are 2 servings of fruits and 3 servings of vegetable a day. So fruits and vegetables, we can get vitamin A, we can get folate, we can get vitamin C, and we can get iron. Then the next layer, we have rice, other cereals, whole grain cereal-based products, and tubers. So importantly, we want to recommend more people to take whole grain products. So this layer of food group, they have vitamin A, they have vitamin B12 for those cereals that are fortified with vitamin B12, folate and zinc. And going up, we have fish, poultry, eggs, meat, and legumes. So, and these are the food groups that give us the more variety of nutrients like vitamin A, vitamin B6, vitamin B12, folate, vitamin D, zinc, copper, selenium, and iron. And beside this, we have milk and milk products. The recommendation is 2 servings per day. So these are the source of our vitamin D. And even though we encourage people to avoid food that are high in fat, but we don't say that we need to go for fat-free diet. We still need some oil, fat and oil in our diet, because these are all the sources of the vitamin E. So if we are able to eat as what been recommended by our Malaysian food pyramid, so basically we are able to gather all the important nutrients that support our immune system. But unfortunately, based on one of the survey that is done in 2019, 95% of Malaysians are not eating enough the fruits and vegetables. We are 2 servings of fruits and 3 servings of vegetables. Out of 20 people, only 1 people is able to consume enough fruits and vegetables. So now I think it's the best time, because we want to support our immune system to fight against COVID-19. So always remember, we must take 2 servings of fruits and 3 servings of vegetables. And we mentioned that those who are obese, they are more likely to get severe complications of COVID-19. But actually, being obese also has direct effect on our immune system. So people who are overweight or obese, they have lower immune capability, they have impaired immune function, they also have reduced antibody production. So that makes these people at very high risk of getting infections from either bacteria, virus, or fungus. And getting the disease, people who are obese or overweight are also having poorer recovery from those who are having normal body weight. So this again emphasizes the importance of achieving a normal body weight or healthy body weight. So after we discuss the nutrients that are very important for our immune functions, then now we talk about nutrition during lockdown or during movement control order, because one way of the virus is they travel with human. If we can restrict our movement, we can reduce the potential spread of the virus to another person. So people have studied that during lockdown or during the movement control order, most people will be having unhealthy dietary patterns, which means the unhealthy dietary pattern, which is eating a lot of sugary and salty snacks, candies, chips, popcorn, or dessert, and foods that are high in energy but low in nutrient. So we need to emphasize again, having excessive sugar, excessive oil makes someone having high body weight, and that affects the immune system. So And these foods, they are very high in energy, but they are very low in nutrients that are so important to our immune system during COVID-19. And people at home generally have lower physical activity, so that also contribute to weight gain. So all this will have indirect effects leading to a poorer immune system. So what are the recommendations during the lockdown, during the EMCO or MCO? Go for fresh or minimally processed foods. Although we may not a lot of people will go for panic buying because they are so afraid of lockdown, so they end up buying a lot of canned products or processed products which are very high in salt. And when we prepare food at home, try to control the use of oil and fat and salt and sugar, and limit the consumption of the purchase of processed or ultra processed foods like French fry, soft drink, cookies, ice cream, which are high in calorie but low in nutrients. And use all types of fruits and vegetables in recipes. And avoid buying commercially prepared meals that are rich in sodium, trans fat, and calories, like all the instant noodles. Don't go for panic buying. And as I mentioned earlier, always plan for grocery shopping, limit the frequency. We buy what we need and we plan ahead, okay? And we build up a stock of healthy snack and practice healthy eating and pay attention to the portion size because we don't want to become overweight or obese during the lockdown. And listen to our body. When we eat, are we really hungry or we are just bored at home? So it's very important that people, when they get bored, they tend to eat. So that's not how it is, because if we consume more than what we need, that's how we will gain excessive weight. And avoid weight gain during lockdown, that's very important. And there's a recommendation to say that we may expose our arm and legs to the sun every 15 to 30 minutes because this helps our body to synthesize vitamin D, which is one of the important nutrients for our immune system. Then we will move on to nutrition and recovery. After a lot of precautions, somehow the virus managed to infect someone, and nutrition also play a very important role to help the recovery process. We mentioned about having overweight or obese is bad for the immune system, but let's not forget the another group of people who are having malnutrition or undernutrition. Study has shown that a lot of COVID-19 patients, when they admitted to the ward, they are actually very malnourished. This suggested that those people who are malnourished, probably not eating adequately, their immune system is not as good. So makes them very high risk of getting infection. And there's also negative impact for someone who are malnourished or with malnutrition on the severity of the COVID-19. Because when we are lost of muscle, when we are not eating enough, we are not only losing the muscle at our arm and leg, we also need to understand we will lose the muscle of our respiratory or cardiac muscle. So this will affect their function, as well as the loss of the skeletal muscle that will impair our movement and our daily activities. So usually in hospital, we will do a nutrition screening to see whether the patient are at risk or malnutrition or not, because if those patients are at risk of malnutrition, then we can give the proper treatment. Like, for example, this is one of the screening tool that we use is nutritional risk screening. So we will ask the patient whether they have weight loss, whether they have poor oral intake, and we'll look into their BMI, and we will calculate how many points. So for those at higher points, meaning they are at a risk of having malnutrition, so therefore we need to give proper treatment accordingly. Adequate energy and protein is very important because we want the patients not to lose weight, to maintain the body weight and prevent muscle loss. Okay, so we don't say that because that person is overweight and obese, so they come into hospital and losing weight is good. So there's a difference between one person losing weight using the healthy method like controlling the portion size and as well as exercise, compared to losing weight because of illness, because we are not only losing fat but also losing muscle. So this is things that we do not want, and we need to make sure. So during the COVID-19 patients, for COVID-19 patients, we always need to ensure adequate energy and protein as well as micronutrients, not to forget, because micronutrients help to support the immune function to fight against the virus. Drink enough water. And what is the barrier is because some people with COVID-19, they will have loss of appetite, they will have nausea, they feel like they want to vomit, they loss of smell and taste that makes them don't feel like want to eat, and it's very difficult to swallow for some patients. So these are the barriers that makes them not eating enough. So some suggestion may be given, like, we will suggest them to add extra protein and like chicken, beef, fish, tofu into rice, vegetable, soup or salads. Add fruits into yogurt or prepare milkshake, because yogurt is a source of protein and fruits are all the source of vitamins. They are important for immune system. Add boiled eggs at breakfast. Choose nuts or dry fruits as snack, and add peanut butter to toast or crackers. So not only want to improve in terms of the calorie and protein, we also hope to improve in terms of the micronutrient consumption. For certain patients who really cannot eat enough from the food, then we will give oral nutrition supplements. So this is in the form of powder or liquids that we will recommend the patients to take as a snack or at the end of the meal. So oral nutrient supplement is not meant to replace the main meal, but it's more to supplement additional calorie and protein as well as the nutrients. For some patients who require to be intubated, meaning they need to receive a breathing support from a ventilator, like the picture shown here. So, with a tube at the mouth, so they can't be eating, and most of the time they are sedated. So, at that point, we will put a tube from the nose directly to the stomach, and we will give all the nutrition via the oral nutrient supplement. So then the healthcare provider, we will calculate what is the energy requirement, what is the protein requirement. Then we will give the regime, like how many scoop of the powder added with water, and we will feed every 3 hours or 4 hours, depends the hospital setting. So even though they are in ICU, they are in intubated, they are on ventilator, we still need to make sure good nutrition is given to help them. And then for certain patients that their stomach or their gastrointestinal system or intestinal tract is not functioning, so we have to give parenteral nutrition, meaning that the nutrition is given directly to the via the blood access. Yeah. So, and this we call it as intravenous. So we will put an access from via the venous system, and we will give the nutrients in the form of glucose, amino acids, and lipid emulsion. So this is different because when we are eating the food via orally, we are eating it in the form of carbohydrate, protein, or fat. These are in a very complex form, but when it went into our digestive system, we will break down the carbohydrate to become glucose. We will break down the proteins to become amino acid. But for parenteral nutrition, because we are giving the nutrition directly into the bloodstream, so it usually is given the form of glucose and amino acids. And because lipids is not soluble in water, so that's why it's given in the form of lipid emulsions. And we also add vitamins, minerals, and trace element into the solution. Together will be given intravenously to ensure that even patients in hospital will still provide adequate nutrition. And after some patient removing the intubation, what we call extubation, we remove the support from the ventilator. So we will introduce back the oral nutrition. Some people, after their prolonged intubation, especially for COVID-19 patients, they may have difficulty to swallow. So at that point of time, we need to give some specialized diet, or we may go for tube feedings, depending the condition. So, and some studies are showing that even those people that recover from COVID-19, they probably still have some symptoms that persist for or last for weeks or months, and including like difficult to breathe, tired or fatigue, difficult thinking or concentration, sleep problem, rash, mood changes or change in smell or taste. So it's very important that even post-COVID, we need to ensure good nutrition for recovery or to prevent further muscle loss. Then we move on to nutrition and COVID-19 vaccination. So now we are trying to vaccinate as many people as possible. So, but again, we are coming back the nutrition aspect, which is being obesity, because study has shown that those people who are obese or with large waist circumference, they produce fewer antibodies after COVID-19 vaccination. So not only specific for COVID-19, but also for other vaccines like influenza, hepatitis B, or rabies vaccination, people who are obese also tend to have lower response. But having said that, it's not to tell people who are obese don't go for vaccination. It is important that we must always maintain a healthy body weight if we want to have good response for our vaccination. Because we have discussed earlier, people who are obese, they tend to have poor immune response as well as lower antibody productions. So to summarize everything that I've said, it's very important in COVID-19 pandemic, maintain a healthy body weight. If there's no other time, now is the best time for us to take care of our nutrition properly, because we need to eat a variety of food within recommendation to ensure that our immune system is working or functioning perfectly to fight against COVID-19. Be physically active, but always maintain social or physical distancing, following SOP, and not to forget, nutrition is a very important component of the recovery from COVID-19. And that's all from me. And thank you very much for still staying with us. And if you have any questions, if I'm able to answer, I will gladly answer it. Thank you very much. Sorry, you are muted. I can't hear you.
Sorry, hello? Thank you for the wonderful presentation, Dr. Khor. It's very interesting, especially in the post-COVID symptoms. So we have a few questions here from the audience. One of them is from Peony QC Yong. So the question is, do we have to sterilize food that we buy from vendors?
Okay, a lot of people ask that question. Actually, we do not need to sterilize everything. So as per the CDC recommendation, when we handle the packaged food, after we handle, we just need to wash our hands. And for fruits and vegetable, we can basically just clean with wash with the clean water. But there's some recommendation. Let's say if we have a delivery, if we bought something from online, be precautions as you can sanitize the outer layer. But this is not referring to the food items. I'm referring for all the things that we can bought from online, either it's Lazada or Shopee. That's when, you know, the courier service, they send it to your house. You may leave it under the sunlight, or you could use some alcohol to sanitize it. Yeah.
Oh, that's very interesting. Another question is from Anislia Patricia Rafael Moy. She asked, what will happen if someone consume excessive iron?
Okay, when someone consume excessive iron, of course, when we are consuming more than what we need, our absorption rate will be low. But having to say that if someone consuming excessive iron, it actually can cause another problem, which is leads to the poor impact the immune system. So, and for those people who need to have like those with thalassemia, and then they have a lot of blood blood transfusion. So iron overload can also harm the liver. Yeah. So we are talking in a two perspective. One is from orally, that of course we will have lower absorption, but having extra also will reduce our immune function. And those who require transfusion, also we're having too much of iron will harm the liver.
Another question from Bell Nancy. Is the diet of COVID-19 patients different or similar to the diet of non-COVID-19 patients? If not, what kind of food can they eat?
Okay, so it depends what kind of other patients. So generally we talk about people who are staying in hospital. If they do not have a metabolic disorder like having diabetes or chronic kidney disease, so generally it's quite similar. We need to ensure that they are having enough energy and protein, despite they may claims that they are tired, they have loss of appetite, a lot of smell, a lot of taste. They don't feel like eating because, you know, having to smell or taste the food is a joy of the consuming food. So it's not too different from other. Just need to make sure that they're having enough calorie, protein, and all the micronutrients can be achieved.
All right. Another question from Roger at Channel. Doctor, what is the best time that we need to expose ourselves to generate vitamin D?
Okay, so generally the recommendation is not too hot in the afternoon. Probably morning will be the best time, whereby the sun is not too hot, but you still can get a bit of sunlight.
Another question from Don Koslov. Is there any medicines that affect a person's immune system?
There are medications that will probably affect the immune system. Yeah, if I'm not mistaken, even steroid could have some implications on the immune system. And because our immune system is also protecting us from foreign bodies or foreign particles. So for those who are getting a transplant, let's say their kidney transplant, so they are receiving kidney from other person, so our body will perceive that as a foreign bodies. So those patients, they will receive some medication, what we call an immune suppressant, but that is for therapeutic purpose, because they need to avoid the body to attack the transplant kidney. So just to answer that question, yes, some medication will have impact on the immune system.
Oh, that is very interesting. Another question from Peony Q Siyong. Can I do anaerobic exercise after taking vaccines?
The recommendation for the Ministry of Health is within 1 week of vaccination, they don't recommend some heavy exercise.
That is interesting to know because I myself recently got my vaccines.
Okay,
Yeah.
so you get that information?
Mm-hmm.
Okay,
Another question
that's good.
from Anislia Patricia Rafael Moy. Does drinking lemon and ginger tea or taking other herbs can help us in preventing the virus or maybe decrease the risk of getting the virus?
No, no food can help you to get to reduce the risk. I'm just talking like in the sense that if you are meeting, if let's say you are having a close contact to a person with positive, no matter what you eat, if the respiratory droplet that carries the virus get inside you, your body, you will get the virus. No foods will help, but lemon is a good source of vitamin C, and ginger also have a lot of different nutrients components that are good for our immune system. So we can say that if you take that, it's a means to help to support your immune system that probably will help to reduce the severity of the disease because your body is able to fight against the COVID-19.
So we have another question from Maulud Mike. Are there honey, garlic, apple cider vinegar, and lemongrass suitable to lower cholesterol and to boost up our immune systems?
As for lowering cholesterol part, I do not see any evidence of having this honey and lemongrass or different herbs combination. Certainly, it has no impact on our blood cholesterol. The most direct impact of the blood cholesterol would be from the type of fat or oils that someone consumes. So that will have more direct or more meaningful impact. Or those we can lower cholesterol that has been proven, including fibers. That's why people are talking about oats, the beta glucans. They are, or those are the source of soluble fiber can help to lower the cholesterol. So whether they are able to help with the COVID-19, there's studies, but mostly on animals that have yet to be done in clinical. I would not say it's a bad or good, but I would say you could include all these foods as part of a healthy balanced diet to add more flavor or varieties.
All right. Another question from Albert Harry Elias Alexander. Dr. Khor, I have heard the phrase immunodeficiency mentioned for patients of COVID-19 leading to death. Is this caused by lack of good nutrition?
Someone having immunodeficiency could due to a lot of reasons. Like if they have underlying diseases such as HIV or other diseases could also impact the immune system. But I would say having poor nutrient intake, especially all the micronutrient, could be one of the reasons that weaken our immune system. But whether it will directly lead to cause of that, I would not dare to make such a statement because we have not been having a lot of data to look into deficiency in certain nutrients and the direct link to the death among people with COVID-19.
All right. Another question from Marisis A. Adakah budak-budak sekolah yang banyak makanan berlemak dan bergula akan terdedah kepada virus COVID?
Dia tidak akan menyebabkan mereka terdedah kepada virus COVID, tetapi kalau makan banyak makanan bergula dan berlemak menyebabkan badan mereka bertambah berat badan, menyebabkan obesiti di kalangan kanak-kanak. Dan seperti yang diterangkan tadi, obesiti akan akan ada kesan terhadap sistem pertahanan badan kita, mengurangkan antibody yang dihasilkan. So dia akan secara tidak langsung mengurangkan keupayaan badan kita untuk melawan virus ini melalui meningkatkan berat badan. So oleh itu untuk kanak-kanak di sekolah kita masih kena menekankan kepentingan mengambil buah-buahan dan sayur-sayuran yang mencukupi, ambil bizirin penuh, minum susu, maksudnya ambil a variety, ambil pelbagai jenis makanan mengikut keperluan zat makanan seharian.
All right. So there's a few questions about food intakes after taking vaccinations. A few of them are asking what kind of food that we have to eat after taking vaccinations, or what kind? Oh yeah, especially after vaccinations.
Okay, there's no specific recommendation what foods that we need to eat. So it go back to general advice. We expect everyone to eat healthily, eat a variety of food, eat as per the recommendation of our Malaysian food pyramid.
So there's a question if if about binge drinking of beer after the first dose of COVID-19 vaccination. Is that good for some people?
If I'm not mistaken, having too much of alcohol is not good. So I wouldn't be able to share much evidence, but in general, binge drinking is not good.
Generally,
No,
alcohol isn't that good.
yeah, it's not good. Too much is not good, I would say.
Yeah. A question from CJ: what bad effects will some have if they have low immune system, and why do people who are positive for COVID-19 lose their sense of taste and smell? Interesting question.
If someone is having a low immune system, that sort of makes them difficult to fight against the virus or any all kind of bacteria or fungus infections. So I'm just taking an example of those patients with HIV. So those days before with proper treatment, they are having low immune system. So they are very they get a lot of diseases that normally people would not get because the body cannot fight against that. But of course, with the new treatments, things don't happen anymore. So I'm just giving an example, like the immune system is very important to help us to fight against different diseases, either from bacteria, fungus, or viruses. Why someone will have implication on taste and smell, I am not very sure in terms of how the process happened, but it appears that it has been suggested that the virus may impact our nerve system that help with tasting, because the taste means that the feedback from our tongue to our brain that okay, we are sensing that this person is eating sweet or sour or salty. So there is some speculation that it affect that nerve system. Yeah, that's why some people lost the sense of smell and taste.
Yeah, I guess different people have different levels of losing the sense of taste and smell. Like some can still taste the sweetness, some cannot taste the sweetness at all.
Exactly, because the symptom is very heterogeneous, meaning that people just having different symptoms. Yeah.
A question from Serena Jane: is it true that COVID-19 is airborne?
Most evidence is suggesting that it can be airborne, but also, as stated earlier, because our respiratory droplets can vary in sizes. Those that are bigger droplet, they will fall on the ground, they will fall on any object. Those that are very small droplets, as what we say is the aerosol particles, they can remains in the air for hours. If not mistaken, they can remain in the air for hours. So that's why if someone pass by, someone sneeze, and then the particles in the air for hours, and someone pass by and inhale that, that's how it get into the body and cause the disease. So there's still a lot of debates that I would say those days we recognize that it's from the respiratory droplet, but nowadays there are people suggesting it could be airborne. That's why we are suggesting a two-face mask if possible to make sure it covers the nose, the mouth, and has to be well-fitting mask.
So there's a question from Tira Zandra. She asks, do vitamin C supplements help us?
We actually we do not need vitamin C supplement because our daily vitamin C requirement is around 70 to 80 milligram per day, that easily achieved by consuming two servings of fruits and 3 servings of vegetables. If someone would like to take it, I would not stop the person. but do not consume excessive, because people who take too much of vitamin C, excuse me, especially those above 1,000 or 2,000 milligram, they are at risk of having kidney stone after taking the vitamin C. So I would not recommend to go on that. I have my client asking me this question, but because he already bought that, so I said, okay, probably you can take it, but maybe not every day, because the vitamin C is like 200 or 500 milligram. That probably is a requirement for 1 whole week. And vitamin C is very a soluble vitamin, so it will get excreted out. It don't store in our body.
I see. So be careful, audience, if you don't eat too much vitamin C. There's
Yes,
a question
excess
from,
toxic dose.
So since it's durian season, is it okay to eat durian after getting vaccinated?
Well, there's no study to say that you can't eat durian after vaccination. You can eat, but again, excessive durian causes too much of calorie intake, and then it may help. It may, in a way, indirectly affect your intake of other food items that are more nutritious or having different nutrients. So I think you can enjoy durian, but in moderation, not having too much that you eat three, 3 biji sekali, tu banyak sangat lah.
I guess the pengajaran here is not to eat food excessively.
Exactly.
Yeah.
Anything excessive is also not good.
Yeah. So Jasper Wong Yi Kiat asked, does a person show any symptoms when their blood sugar is too high before they are diagnosed with diabetes?
If someone is having diabetes and their blood sugar is high, they actually have a lot of symptoms. They always feel thirsty, because when you have too much sugar in the blood, it sort of make it quite concentrated, right? So feel thirsty. They also go a lot of pass urine a lot, and that also causes them to become thirsty actually. And then they have poor vision. They will have a bit blur vision. They feel tired. The wound, if there's any wounds, is very difficult to heal. Yeah, so basically, the most very direct impacts we will see is frequent urinations and drink a lot of water.
I see. Kennedy Aaron Agwal asked if taking cordyceps, as in chicken essence TCM, traditional Chinese medicine, could boost lung function.
Could help what lung function?
If taking cordyceps, as in
Mm-hmm.
chicken essence,
Yes.
traditional Chinese medicine,
Can
if it could boost the lung functions.
Oh, the lung function.
Yeah.
I do not research a lot in Chinese tradition herbs, so I really can't tell it's a yes or no. So I apologize for that, because that is not within my expertise or within my knowledge about that.
I see. Ross Sogunting asked if HSP and G6PD, about what's the diagnosis are and what's the nutrition supplement.
Sorry, I don't get G6PD. Is it an enzyme?
I'm not sure, because the question asked about how about the HSP and G6PD diagnosis? What's the nutrition supplement?
I apologize again that I'm not come across with this kind of nutrient supplements. But if in overall, I would not recommend any specific supplements in relation to COVID-19 prevention, because there is none. But if someone who can eat adequately, eat a variety of foods as per the food pyramid, eat adequately, I do not see the needs of taking a supplements. And whether it will have additional impact on COVID-19, as I researched, there's no such supplement that can help.
I see. Engelbach, he asked if COVID-19 patients they don't have specific treatments, right? So what are the best solutions treatment for the patients?
It's usually supportive treatment. So there's no direct medication for the virus. So it depends what symptoms, and if they have breathing problem, they will get support from that. So that's why it's more like supportive treatment.
Titi Hawa Sabari asked if the fruits that are mostly expensive for today, if there are other alternatives for fruits.
Oh, any fruits are good. Like, you can have banana, you can have papaya, watermelon, apple, oranges, all kind of fruits have different nutrients. So we do not specify any fruits are better than another. But if you can have different fruits of different colors, that indicates there are different nutrient profiles. Like we have orange, which is in orange color. You have pineapple that can be in yellow. You can have red apple. You can have watermelon is red color. You can have kiwi, or you have green apple. You can guava that's in green color. You also can have grapes that's in purple color. So having a different color of fruits gives you a different nutrients, and also make the food looks more attractive.
I hope that answers the questions of some of the audience asking about what kind of fruits they have to eat for the vaccine. And I'm
All
taking
kind
that,
of fruits.
yeah. I'm taking the last question from the audience for today before I end the session. So there's a question from Shen Xiang Chan. Is taking sub-X zinc supplement good?
So again, what supplement?
Sub-X zinc.
Zinc. Oh,
Yeah,
okay.
zinc.
I catch the zinc, so I think that there is study that, because as I say, zinc is known to it's important to fight against the RNA virus. So there is study that is done in overseas. I can't remember which country. They look at combination of zinc and vitamin C against COVID-19, and there's no effect. And in fact, those people who are taking those supplements, they experience a lot of side effects, like they got nausea and some gastrointestinal discomfort, if not mistaken. So at the end, there's no benefits of taking supplements that beyond your daily requirements that you can easily achieve by eating a variety of foods. So I think that is not such an indication for zinc supplements here.
I see. Well, I guess that's all for today's Q&A session. Thank you for all the audience for your very interesting questions. There was an influx of questions. I'm sorry we couldn't answer all of your questions for today, but I hope that today's session will be enough to answer some of your inquiries. So to wrap up this session, thank you, Dr. Khor, for your session for today, Nutrition and COVID-19. That was a very interesting presentation. And then for the audience, the link for registration and e-certificates will be provided in the link after this. So school students and UMS students, you can register through the Google Form link, which will be provided later by the end of this session. All right. Thank you, Doctor, for the talk. I was very impressed by some of the additional information, especially some of the symptoms, additional symptoms post COVID-19 that we experienced, and some of the very information about health style, our lifestyle. And I guess that's all for today. Thank you again, Dr. Khor, and everyone that is present for today.
So thank you, everyone.
So there will be another STEM speaker series session, which will be held in the next week at 10 p.m. For more information, you can follow our Facebook page, Science team. Thank you.